R. Venkatesh, who is the Chief Medical Officer and Chief of Glaucoma Services at Aravind Hospital, Pondicherry. And he has worked extensively with Remedio for the glaucoma and the NDR screening. And to give you context, like Dr. Venkatesh has research and clinical interest in the use of technologies for the early detection of chronic eye diseases like glaucoma and diabetic retinopathy. He has graduated in medicine with a gold medal in ophthalmology from Annamalai University and has done DO and DNB from the Aravind Hospital, Madurai. He has also published around 70 research papers in peer-reviewed journals and the international journals and 4 publications in state journals and has authored 10 book chapters so far. So over to you, Dr. Venkatesh. I have your slides. Request you to restrict it to around 5 minutes.
Okay. Thank you, Shantanu, and thank you, Anand, for introducing the topic. And it's an amazing solution which we are now using in some of our vision centers. Now, can you go to the next slide, please? So, Aravind is got a network of tertiary and secondary eye hospitals, but we also want to reach the unreached, especially in the semi-urban and rural areas, where we have something called primary eye care or vision centers. So this is basically to provide a permanent eye care service in that particular area, where normally an outreach used to happen, an eye camp once in a month or once in 6 months, once in a year, which is very ad hoc. And so we wanted to change the health-seeking behavior in that community and also increase the uptake of eye care services. And as a result, we can reduce the backlog of blindness, especially blindness which are preventable, like cataract, diabetic retinopathy, glaucoma, refractory errors. Next slide. So now we have a network of vision centers across the Tamil Nadu and Pondicherry. We have 105 centers now, which cover almost 15 to 20 million population. And more than 500,000 patient visits we see every year in these vision centers. The best part is the vision center, wherever is located, almost 40% of the people who need eye care in that locality or community will access the vision center in a year, and 75% by 2 years, and maybe you get 100% of coverage in 3 to 4 years. And the other important point is 85% of the problem can be resolved in the vision center itself, and only 15% needs referral to a secondary or a tertiary care center. So this is a facility which you are seeing, which is like a 600 to 700 square feet facility, a space for an optometrist and a space for an ophthalmic assistant who registers the patient, does some basic investigations like blood pressure and blood sugar, and then she also dispenses medicine and opticals. The optometrists do a detailed eye examination, including intraocular pressure, fundus imaging, and then uploading it into the electronic medical record. And a telemedicine happens with a trained ophthalmologist from the base hospital. They are usually senior residents who are with us. Next slide. Financially, we have seen it is sustainable over a period of couple of years. And they charge a consultation of 20 rupees for eye examination. And to set up a vision center, it roughly cost around 10 lakh Indian rupees. Next slide. So these vision centers, what we have seen is, the images have been uploaded, and at the end of the day, the telemedicine connectivity was an issue in some of these rural areas. In spite of the good connectivity, we still had issues with broadband issues, electricity issues, and sometimes we were not able to complete the telemedicine. And that's where we were looking at solutions beyond just imaging. And when Remedio came up with the AI solution for diabetic retinopathy, it was very critical to use these solutions. And now we have been validating the glaucoma AI also for them. And recently we have completed some good validation, both at the vision center and the base hospital. And this is a study which you see, which is done at the base hospital. We just completed, and it's going to be published soon, where we found that the sensitivity is as high as 85% and the specificity is really good, almost 97%. So these are patients who are either glaucoma or glaucoma suspects, and they have been seen in the base hospital by an ophthalmologist with all the necessary investigations like a scanning and visual fields and things like that. So what we found that the AI shows really promising results to detect the referral warranted cases, the patients which need to be really referred to the base hospital. Next slide. And also we found that this AI solution looks very promising when compared to a specialist who is a glaucoma specialist sitting in a base hospital. And also this as used in vision center where there are no expert doctors to help identify with referable glaucoma. Again, the telemedicine was done by many of our senior residents, and we found that a lot of false positives are coming to the base hospital. Now we found that the AI solution really filters a lot of false positives so that we really get patients who really need to travel to a tertiary or a secondary care center for further evaluation. This definitely saves a lot of their time, cost, the carbon footprint, and also the anxiety of many of these patients. So this is one solution. Now we are looking at after validation to be practiced in most of our vision centers. Thank you.